নমস্কার, আপনারা দেখছেন অ্যাপোলো হসপিটালস চেন্নাই প্রেজেন্স হ্যালো ডক্টর। আপনাদের সঙ্গে রয়েছে আমি স্মৃতি। অর্থোপেডিক প্রবলেম, হাড় সংক্রান্ত সমস্যা, এই সমস্যা নেই এমন একটি পরিবারও এখন খুঁজে পাওয়া মুশকিল। তো এই হাড় সংক্রান্ত সমস্যা, অর্থোপেডিক প্রবলেমগুলি কিভাবে এটা আমরা আগে থেকেই প্রিভেন্ট করতে পারবো, লাইফস্টাইলে কি চেঞ্জেস আমাদের দরকার এবং রিসেন্ট অ্যাডভান্সমেন্ট কি রয়েছে। কারণ এই সমস্যা ব্যথায় জর্জরিত, হাড়ে মজ্জায় ব্যথায় আমরা অনেকেই জর্জরিত। আর আমরা কষ্ট পাবো না। অ্যাপোলো হসপিটালস চেন্নাই আমাদের সমস্ত কষ্ট, সমস্ত ভয়, সমস্ত বিভ্রান্ত দূর করার জন্য রয়েছে। তার এক্সপার্টসরা রয়েছেন, তার এক্সপার্ট ডক্টররা রয়েছেন। আমাদের সঙ্গে এই মুহূর্তে অ্যাপোলো হসপিটাল চেন্নাইয়ের তরফ থেকে রয়েছেন ডক্টর ভি রবি, সিনিয়র কনসালটেন্ট স্পাইন সার্জন, অ্যাপোলো হসপিটাল চেন্নাই। ডক্টর রবি, welcome. Namaskar. Dr. Ravi, firstly, thank you for coming from Chennai and welcome. Hello, doctor.
Thank you very much. Thanks for your invitation.
Sir, orthopedic problem, it is a vast topic, vast problem. Sir, we discuss on the program one by one issue. Sir, firstly we discuss osteoporosis, যাকে আমরা হাড় ক্ষয় বলি। মহিলারা এই হাড় ক্ষয়ে এই মুহূর্তে জর্জরিত প্রায় বলা যায়, 30-40-এর পরই এটা আমাদের দেখা যায়। স্যার, সো ফার্স্টলি উই ওয়ান্ট টু নো ওয়াই রিসেন্টলি most of the female are suffering from osteoporosis. It is a age-related disease or calcium deficiency disease.
The bone density as you are growing as a child keeps on increasing up to the age of say 20 to 24 years. After that, the bone strength keeps on decreasing. So when you are younger, at that time if you build your bone strength, that is very important. That time you need to take your calcium, especially girl children, they don't take milk, so that prevents them from getting enough calcium or vitamin D. So and physical activity, all that keeps on building your bone strength. And if you want to maintain that bone strength, you need to do the regular physical activity. At least 40 minutes of walking for women is a must. And women after the menopause, because of the hormonal changes, they tend to develop the osteoporosis. It's very common, and because of our low physical activity, second, not taking enough calcium and vitamin D, we tend to develop this osteoporosis. But it is a medical condition. If detected early, it can be treated with medicine and they can get back to normalcy.
Sir, what is osteoporosis fracture? Osteoporosis is common, but fracture is common.
Yeah, fracture, sometimes if it is neglected for too long, we don't diagnose it early, then they go in for a spontaneous fractures. They can develop fracture in the spine, which will cause wedge compressions. So even at that stage, if you detect early during the fracture, we can still give medicines, all that, and make it all right. But if you neglect even after a fracture for a long time, then we need to go in for a procedures like what is called rplus, which is done under local anesthesia. We inject a bone cement into the fractured spinal bone, and they can walk after an hour or so. So they get back to normalcy faster. So these interventions are possible, but the main thing we need to understand is we have to prevent it by increasing our physical activity, maintaining exposure to sun, and taking good amount of calcium and vitamin D in your day-to-day activity.
What is sleep disc? People thought that the bad sleeping style are causes, isn't it? And recent advancement, what is you see recent advancement treatment on sleep disc?
Slip disc, we generally in the spine there are 33 bones. In between the bones there is what is called as a disc, which gives you the flexibility and mobility. It's like a cushion. So normally in a patients with a sedentary lifestyle, not doing enough exercise or excess manual laborers, all these people, the water content in the disc decreases. That means it becomes dry, so it loses its elasticity and it has a tendency to slip backwards, go and press on the spinal cord or the nerves. That is causing what is called the sciatica. You tend to get the back pain, you tend to get the pain coming down the legs. So to prevent it, physical fitness is very important. If you have a less tummy size, that means less stress on your spine, so you tend to avoid back related issues. Other thing is physical activity also will reduce, and take care of when you are sitting, you have to sit with the hip and knee bent 90 degree with the proper back support, and every half an hour you get up and walk around and sit back. By that way you can prevent back strains or back related issues.
Sir, we heard many type of infection, but spine infection is a major issue. or is a rare issue? How is it the treatment and recent advancement in treatment? How can?
Spinal infections are not a rare entity, it is common. Previously we used to have a lot of cases of spinal tuberculosis, which if it is detected early, it is only can be managed just with medicines, and medical treatment is good enough to heal the infections. But many a times patients neglect that. They don't approach the doctors on time. By the time the bone is destroyed, spinal bone is destroyed, starts compressing on the spinal cord or the nerves, causing weakness or the radiating pain, that is the time they approach. Then if it is detected early, we can just do a biopsy, confirm the infection, what type of infection. It could be a TB, it could be a pyogenic or a bacterial infection, or it could be sometimes fungal infections. So it can be detected just by a biopsy and testing, and then treatment is only medical. If it goes to the extent of destroying the bone and causing instability or compression on the spinal cord, that is the time it needs surgery. Even at that time, if we detect, we can bring them back into normalcy.
Sir, what are the symptoms, sign and symptoms of spine infection?
Spine, anybody who is having acute pain which is disturbing your sleep in the night, the pain is disturbing your sleep, that means there is something severe. Either it could be an infection or it could be a tumor. So second thing is any pain which is radiating down the legs or numbness in the legs, that means there is significant compression on the nerves. That is the time you need to approach the doctor. So any pain which is lasting for too long, if it is not coming down or gradually increasing, disturbing your sleep, associated with fever, associated with weight loss, then you need to approach your doctor.
Sir, scoliosis and spine infection, what is the difference in between scoliosis and spine infection? Are there same reasons, same causes, same symptoms or not?
The scoliosis is totally different, which commonly affects the young girls. We call that as a adolescent idiopathic scoliosis, where the spine starts bending. So they'll start tilting to one side, especially for girls. So if the mothers, most of the time it is the mothers who observe, when they are bending forward, that time they can notice an hump in the back. So if you notice, or if your shoulder balance is not there, or the pelvis is getting tilted, then you immediately need to get an X-ray done and see how severe is the deformity. If it is detected early, in the mild amount of curves, which say up to 20, 30 or 40 degrees, it can be managed with the brace, and we can try to avoid a surgery. But if it is neglected, not detected early, it can go on progressing, leading to a surgery.
Sir, peoples and almost females, how can prevent it?
The scoliosis. Scoliosis is it can be congenital scoliosis, which happens in a very young children, and most common is idiopathic scoliosis, which happens in the teenage. So awareness about the scoliosis is very important. You can have screening programs in the schools, which will also help you to get rid of it or detect early. And if it is found late after scoliosis has progressed significantly, then you can go in for surgery, and scoliosis surgery is quite safe, and we can make them straight.
Sir, are there any recent advancement in treatment on Apollo Hospitals, Chennai?
Yeah, the spine surgery, previously we used to think that spine surgery means it shouldn't be operated, patient cannot walk back like that. It is no longer like that. Many of our surgical procedures, patient can walk on the same day or the next day, and we tend to discharge them, especially for a slip disc and all, just one day in the hospital. We do what is called endoscopic surgery, which with a 6 millimeter hole we are able to approach and remove that nerve compression and relieve the pain, and they can walk on the second day. So spine surgery is quite safe. Generally patients have a phobia that spine surgery means it is going to be too risky. It's not like that. We have reached a point where we can give a consistently good results, and the patient can walk on the second day. We can discharge them most of the time. Even the major surgeries, we tend to discharge them on third or fourth days.
Sir, spine tumor, what are the causes and what is the symptoms? What are the symptoms and signs early detected?
Like the cancers which can affect anywhere in the body, it can affect the spine also. Most commonly we tend to see is metastasis, that is from the different parts of the spine, of the body, it can affect the spine also and causing you acute pain. So, and same way like the infection, it will have a night pain, you won't be able to sleep well. If it is not detected early, it can go on compressing on your spinal cord, causing weakness. So these are the symptoms. Sometimes some of the tumors are very benign tumors. Those causes a very slow growing tumor which can be detected easily.
Sir, minimally invasive surgery and the robotic surgery and the recent advancement surgery, are they same?
The spine is advanced in many branches, I can call it. We call what is called minimally invasive surgery, where we make a smaller incision. With that, a major operation is being done. Even previously we used to cut open say 3 or 4 inches. Now it can be done with 1 inch, and we can do the same operation. The target surgery is the same, but the approach is made minimal. That is facilitated by the recent advancements in the technology plus the robots. The robots helps us to put our screws into the spinal bones in a much more precise and safe manner, so that the safety levels are improved. So robotic surgery in spine helps in a long way as far as the safety of inserting our screws are concerned. And minimally invasive may make smaller incisions so that the patient blood loss is less, they can get back to their normalcy faster. So recovery is faster, hospital stay is less. So those are the advantage with the minimally invasive surgeries.
Sir, minimally invasive spine surgery, it can be needed a spine tumor.
We can do for even a spinal tumors. If it is detected early, we can do a minimally invasive surgery. With that, we can approach and remove it.
Sir, we want to know what is the success rate and what are your achievement on the surgery?
We have excellent success rate, around 97-98% of people get back to normalcy. They return back to their normal, unless otherwise you come very late to the hospital. So that is the time the recovery is less. So you present early to the doctor with your problems, getting back to normalcy is almost like 100%. When the patient come very late with a significant neurological deficit or weakness, that is the time they get back to slow recovery. All this happens. So if you come, approach the doctor whenever you have a significant pain coming down the legs or coming down the arms, or weakness, or sometimes they present very late with the urinary incontinence or the motion incontinence, then only it's difficult for us to get back to normalcy. Otherwise, if you present early, then you can come back to normal.
Sir, how can prevent it on exercise? I want to say exercise can be cured on those diseases.
Especially back pain and neck pain and osteoporosis, all these diseases can be very well prevented by doing regular exercise. Your fitness is very important for your spine health. Spine is something like a vertebral column which is supporting all your organs of the body, which are hanging on to this column. Not only that, it is giving you the flexibility, and the third one, which is very important, it is protecting the neural structures, the spinal cord, which is traveling from your brain down to the lower part, which is giving you the nerves which are supplying all your parts of the body. So it has a 3 functions. So you need to maintain spinal balance, healthy spine. For that, you need to do the regular exercise.
Sir, when endoscopy spine surgery is needed, and what is it? We don't have any idea. Endoscopy spine surgery, what is it? Please explain.
Endoscopy is a recent advance in spine surgery. I can call that as the least invasive, like a minimally invasive. Next upgrade, next advancement in the spine surgery is the endoscopic surgery. So now we are trying to do whatever the minimally invasive was done, we are trying to do it with the endoscope. Endofusions are available now, where we make a 6 millimeter hole. Through that, we go and remove the compression on the spinal cord for a slip disc and make the patient recover. They will be able to walk on the same day, and it can be done as a day care procedure also. That is a big advantage as far as the back pain or the neck pain or radiating pains are concerned.
Sir, if people or anyone neglect the disease, neglect the treatment, is fatal?
No, it is not fatal, but suppose you have a spinal infection which has been detected early, or people, because of fear, they don't approach the doctor. Then by the time they start developing weakness, sometimes they present to us with the complete paraplegia or the quadriplegia. So that means the whole power in the legs becomes zero. So till that stage they shouldn't waste. They should come early to us so that we can get them back into normalcy.
Sir, younger and elder and old age person are getting suffering from this disease, but children also.
Children, they can develop infections in the spine, yes, that is possible. Or children can have a congenital scoliosis. By birth defect, they can have a deformity of the spine, that is a scoliosis of the spine. So otherwise, generally, we don't get much of a spinal problems in children.
Sir, what is the achievement you are too much excited that achievements that you share on the program?
Achievement is seeing my patients smiling back when they come with the pain, when they relieve, their complete symptoms are relieved, and then they are very happily going back. That I feel is the biggest achievement. So each and as a doctor, that is what gives you the real happiness. So that is very, very important for us. So when I see the patients today, the whole all patients are happy, and that is a big achievement for us. So making our patients happy is more important than anything else.
So why patients choose Apollo Hospitals Chennai?
Basically, we need to understand the patient's problem, and we need to have the team of doctors to deliver that consistently good results, and bringing in that latest technology that is available in the world, whichever part of the world is available, it should be brought into our country, and it should be made available to our people. So by that way, we have an excellent team of doctors, expertise, and the technology that is available, which gives consistently good results to our patients.
Sir, as doctor, what you suggest the female person
regarding the
orthopedic like osteoporosis, scoliosis?
The
that is the most suffering from female.
Yeah,
that's why I asked.
Especially women, they take care of the family well, they neglect themselves. That is the typical of a mother's attitude towards the family. She always compromises her own health for the sake of others. So they need to spend a little bit time to get their health so that they can serve the family better, take care of their children better. So for that, physical activity is very important. They need to do some kind of exercise, at least 30 to 40 minutes a day. That's a must for them. And eating healthy food plus exposure to sunlight, all this will prevent and maintaining the weight is very important. If your BMI is very high, if you are obese, then your chance of getting the spinal problems are very high. Not only that, you will start getting knee arthritis, all this. So maintaining your body weight and overall healthy lifestyle is a must to avoid spine problems also. Not only the heart problem or other things, but also the spine.
Yes. Sir, what type of lifestyle changes can be prevented?
Lifestyle, that as I said, the physical activity is one. Second, maintain awareness about your diet and preventing how to avoid fatty meal to prevent your weight gain. That is a more important thing. So by that way, you will be able to maintain a healthy spine.
Sir, one thing I want to know, what is the difference in between minimally invasive spine surgery from the traditional surgery? What is the advantage? What is the benefit?
Initially we were doing all open, those days we were all doing open surgeries. Then it became the microscopic surgery. Using a microscope, operating on the spinal cord is much more safer. Safety levels increased, but the incision is bigger. Then came the minimally invasive, where whatever we used to do with the 3 or 4 inches of incision became 1 inch. And then came the endoscopic surgery with 6 millimeter of, that is less than 1 centimeter, you are able to do a surgery. So that like that we keep on improving our standards so that the damage to the muscles or back muscles are less, so that the patients can get back to normalcy faster. So that is the advantage with the least invasive surgeries.
Sir, any orthopedic problem, when does it need a treatment?
Not the patient, then generally they think that all spine problems needs a surgery. Not like that. Is one of the reason why the patient comes to the doctor. They try some other kind of treatment methodology. It is not true. To tell them frankly, 95% of the back pain can be treated just with physiotherapy, exercise, all that. 85% of the patients doesn't need a surgery. That is what they need to understand, and the remaining 15% only need surgery. And even this 15%, almost, if they approach on time, we can get them 98% of success rate or 99% of success rate. So I feel not approaching the doctor on time is the major disadvantage with respect to the patient.
Sir, every neck pain is to be a spondylosis?
The neck pain is, of late, we are seeing very commonly in our population because of the many people working with computers, looking down, and use of the cell phone. If you see the children also, or if you are traveling in the train or something, everybody is hooked onto the phone. They don't take care of the neck posture. They always look down like this. So if you are able to maintain a neck straight and the head looking straight forward, that is good for the neck. Otherwise, when you are bending more than 30 degrees downwards, that is the time all your muscles of the neck becomes weak and get tired. That is the time you get your neck strain. So that goes on and on for a long time. Then you go and land up in what is called cervical spondylitis. Sometimes if it is neglected, that spondylitis will become severe and causing compression on the nerves. Then you will start getting what is called the radiating pain coming down the hand with numbness and weakness.
Sir, what is the symptoms of spondylosis?
Cervical spondylosis, as I said, usually present with the neck pain only. If it is prolonged, then it goes on to cause what is called radicular pain, that you will have a typical pain radiating to your fingers. Then next stage, if you even neglect that stage also, you will get what is called myelopathy. Myelopathy means the spinal cord per se gets affected because of the excess spondylotic changes, causing severe damage to the spinal cord. In that case, what will happen is patient will find it difficult to write. When they write, the signature will change. They won't know that it is because of the cervical myelopathy. So at least if they come, if there is a sudden change in your signature, your 60-70-year-old finding your signature is changing, it could be due to a cervical myelopathy. So that way they can approach the doctor earlier. Or they will have a difficulty in walking. They'll have tightness in the legs or some back pain, all that, and or weakness in the legs also. That is the time it shows the cervical spondylosis becomes severe, causing severe compression, leading on to what is called cervical myelopathy.
So do you have any chamber for those patients who doesn't go to any time to Chennai visit the doctor?
So I visit here once in 3 months and to see my patients. Like my patients travel so many thousands of kilometers to see me. It is my responsibility to come and see them in Kolkata. I visit Kolkata once in every 3 months, basically to see all my patients who have been operated by me, so that they need not come all the way down to see me again. So that way.
স্যারদের মতো এক্সপার্টসরা যারা শুধু চেন্নাই থেকে, চেন্নাই অ্যাপোলো হসপিটালের এক্সপার্টসরা শহর কলকাতায় আপনাদের হাতের কাছে, যারা যেতে পারবেন না বা যারা একবার ভিজিট করে এসে বারবার যাওয়া যাদের পক্ষে বিভিন্ন বিষয় থেকে একটু অসম্ভব, তাদের জন্য স্যারেরা আসছেন কলকাতায়। আমাদের স্ক্রলে কিন্তু সমস্ত ডিটেলস থাকছে, ফোন নাম্বার থাকছে। যারা যোগাযোগ করতে চাইছেন বা নিউ পেশেন্ট, তারাও কিন্তু যোগাযোগ করতে পারেন। সুন্দর একটা গাইডলাইন আপনারা কলকাতায় বসে পেয়ে যাবেন। স্যার, থ্যাংক ইউ ফর কামিং ফ্রম চেন্নাই। We sure people will benefit of your advice, and thank you for giving me such a great experience. Thank you for coming.
Thank you.
আপনারাও খুব ভালো থাকুন এবং স্যার যেভাবে অ্যাডভাইস করলেন সেগুলো মেনে চলুন। অর্থোপেডিক প্রবলেম, হ্যাঁ ব্যথা তো থাকবে সঙ্গে, কিন্তু সেটাকে কন্ট্রোল করে আমরা আমাদের জীবনের দৌড় কিভাবে এগিয়ে যেতে পারবো, কিভাবে বজায় রাখতে পারবো, সেটাই বড় কথা। আর সঙ্গে তো থাকলোই অ্যাপোলো হসপিটালস চেন্নাই। আজ এ পর্যন্তই। দেখতে থাকুন rplus নিউজ, সবার আগে সবার।